Hi, Mr. Jones. I'm Tori with the Respiratory Care Department, and I'm here today, and we're going to do some nasotracheal suctioning for you. So first thing we're going to do is go ahead and wash my hands. Okay, and then I'm going to put on some gloves here. Alrighty, so what we're going to do today is we're going to do some suction on you. So the first thing that I need to do is just assess my patient for pulse, pulse oximetry, respiratory rate and pattern, heart rate, and then we also need to hyperoxygenate the patient. So to do that, I'm going to put my patient on a non-rebreather mask, and I'm going to do that for at least 30 seconds, and I'm going to instruct him to take nice deep breaths. It's going to be important for this patient to be hyperoxygenated before the process of suctioning. So then the next thing that I need to do is to pick a size of nasotracheal tube, or nasal airway, excuse me. So to measure the nasal airway, you measure from the tip of the nose to the ear to see if you have the correct size. And then to insert this, we're going to take a water soluble, like Solugel. We're going to put a little bit on there in the palm of the hand, and then we can just do this, just right through the palm. Okay, to insert the nasal airway, the bevel part needs to go towards the septum. Okay, so we have our nasal airway placed. Now the next thing that we're going to do is, we're going to put our sterile, we're going to open our sterile nasal suction kit and apply the sterile gloves. And then we're going to put some sterile saline in here as well. What we need to do is hook our catheter up to suction, and that suction needs to be appropriate for our patient. So for an adult patient, it would be -120 to -150. And so I'm going to go ahead and hook my catheter up to the suction. And then I need to make sure that the suction's going to work. So you can just place it into the sterile saline and include the suction port, to make sure it's going to work. And then you always have to have a sterile hand and a clean hand. And so you're going to wrap the suction around the hand, and this is going to be lubricated. And then we're going to insert the nasal catheter, and then once you can see breath or you feel resistance, your patient coughs, you pull that suction out and you pull the catheter out and you begin to suction, and it should take less than 15 seconds. Okay, and then we would disconnect our suction from the suction from the catheter, and then we're going to hyperoxygenate our patient again for at least a good minute after the process of suction. For this patient, he's going to need to be suctioned multiple times, so we're going to leave the nasal airway in so that we don't cause trauma to his nasal passages by inserting the nasal airway multiple times. Then I would make sure my patient was comfortable, position him, and make sure that I wash my hands, and I disposed of my gloves and my catheter, got that all cleaned up before I left the room.